All right, guys, thanks for coming. Appreciate it. Cell phones off and things? Oh my good, look at all that.
Yes.
Bunch of kids.
I'm going to shut that down.
Right. Dr. Phil, I know you have his little bio there, but he had a store in Chalfont, well, Buckingham, for many, many years called it was Earth Foods. And I don't know how many years he had that for, about 10, 15 years?
It's been there since 88.
Yeah, 88, and he bought it. So he retired, and I think Ray called him up or something. He said, no, you can't retire, you got to come here.
Yeah.
Retirement's for old people, Frank. So we were lucky to get him, and Phil is here on Monday, Wednesdays, Fridays, and Sundays. That's a hell of a retirement. So he's also available for private consultations too. There's a little charge for that, but if you have a quick question or something, we'd be happy to also answer that for you. And we're just lucky to have him, and we're going to talk about ADD and ADHD. And I know I have a grandson that's a little on that scale there. So it's very it's important. So and adults too. So I'm not going to. It's getting a little late, so I'm not going to keep everybody. I want to introduce Dr. Phil Pappas.
All right, can we hear me? Oh, it's got to warm up first. Are we there yet? You got it? Okay, so everybody can hear fine?
Yep.
All right, excellent. So thank you for coming. We're going to talk today about some specifics, and I'm going to take every question you might have. I want to start out by saying that a lot of these things happen on a nice day, so you want to come in an hour and 15 minutes, you want to get out. Well, today's miserable, so I'm going to extend it to 3 hours. So you like that, huh? Okay. No, we're not going to do that. But I want to tell you, in the packet, be particularly aware of the Seinfeld, the Feingold inventory. You can see what I've been watching on TV. The Feingold inventory was our main induction, whatever we call it, tool at Abington Hospital. I ran the Abington ADD program, and when we brought somebody in, we had them fill this out. It looks kind of simple and easy, but it's a really good tool. So everybody should do this today, and I will evaluate each one for you. I'm not going to run away after the talk, and I will evaluate each one and give you an idea of what's going on. This works for children or adults. It just doesn't matter. If you're the parent or the grandparent, maybe the great-grandparent, of a child, you fill it out the way you see the child. If you have a mother and father, it's good that they both do it separately, not on the same sheet, because inevitably they will not be the same answers, or they'll be similar, and then we kind of figure out where we are. So that's one thing I want you to be aware of. Let's see what else we have. There's a copy of what I'm talking about today for your review later. This is a great piece. This we didn't have before. So I've done this lecture a few times over the years. So this is a new piece. I think we call it the circular something, but whatever it's called, I love the way it's done because it kind of, and you'll see as we go along here, it kind of picks the different weak spots that a child or an adult might have, and it tells you what you need. So I like that a lot. It's kind of a guidance tool, something to just, what should I do next kind of thing. So that's a great tool. We are going to also be looking at the, what do I call this one? The 4 lobes, the 4 traits. This is a great piece. It kind of focuses you in. Once you do the Feingold inventory, it focuses you in on what the weak spot is. And then you say, oh, that's the neurotransmitter I want to work on. So keep that in mind. So as we start to get information and you start to toss this around in your head, I think I know what the weak spot is on this child or myself. And then what do I do about it? So keep all that in mind, and then you know, when you get home, you might change your mind about this. You might say, well, you know what, I'm not so sure that was right. Let's look at this. So we'll learn a lot today. So I just want to start off the whole thing by saying, yes, I ran the Abington ADD program for quite a few years at the hospital, and then we moved the office to Jenkintown because we needed a larger facility. But we were in the hospital for a lot of years, even before I took over as director. And we learned, you know, I thought I knew a lot about ADD, but when you're doing it, you know, all the time, 6 days a week, 8 hours a day, and you're seeing all these different children with all their different problems, it becomes, you become aware this is not a one type of condition. This is complicated. And we're going to try to break some of that down for you. So this slide I always show because the worst thing you can do, so this is the worst scenario, we labeled this child ADHD. What you don't want to do is run and get your child labeled. Or if you're an adult, you don't necessarily want to get yourself labeled as ADD. Remember, a child that takes Ritalin and other drugs has a history. And that history may come back to haunt them either through insurance. Oh, it shut off. How do you like that? There we go. They could have insurance problems when they get older. They could have trouble getting certain jobs. So this has turned out to be a little bit of a, you know, around their neck kind of thing when they grow up. And as an adult, you don't necessarily want to throw that information around. So the whole idea of identifying a child and identifying a child quickly is particularly an issue. In adults, you can hide it better and it doesn't show up, but in a child, it's all through the records. And it might be a mistake. It might be labeled wrong. And then you're stuck with that label. And what do? You know, it just follows them all through their whole learning experience, including college and who knows, work experience. So not a good thing. This is just to show you, and it's old. It's getting old, and I can't find a new chart. I'm sure eventually I will. But the incidence of identifying it is rising. I'm not saying that the incidence of the condition is growing. We're just identifying it more and more. And as we do that, you say, well, that's good. Now we can get services in place and all that. Yeah, that's true. But then you've got the whole pharmaceutical industry thinking, this is a good category for making money. Yes?
Is this same kind of situation been discovered to exist in other countries?
No. Good question.
Has there been any studies?
In other countries, they don't label things like this quite as much. Depends on the country, obviously. And they treat it differently. In fact, maybe now's a good time to kind of say that. I've got the next slide, which might help us talk about that for a minute. All right, so there you're looking at what, in general, what do we call this? So when I started out in the 90s, we had ADD and we had ADHD. But people started looking at it and saying, well, it's really all ADHD. It's just that this group over here doesn't show that hyperness, but they're calling it ADHD. I call it learning differences because I don't think it's a disability. I think it's a learning difference. And believe me, your child will appreciate the word learning differences over learning disability. And I'm going to run a little video now to show you what I mean. But, you know, this is part of that whole labeling system. And I'm really not real pleased with what I see. So a child may, if you look at the bottom here, a child may appear shy, reserved, and calm. So we used to think of those as like the little space cadet that just kind of sits there and daydreams, you know. That's a form of a learning difference. Now over here, these are the obvious kids. They get a lot of grief because the teacher doesn't like them or that doesn't want to put up with it. They're bouncing around. They're saying things inappropriately. They're coming out with all kinds of hoots and screams, and you know, somebody drops a pencil in the back of the room and they're up looking, you know, and you know, you don't even know why. It's the strangest thing. But as I watch them, I think, what are they thinking? You know, they're not they're not really hanging into the program very well. They're kind of just, you know, they don't want to be there probably. So I just want to show you, assuming I can get out of this, here we go. My daughter made a movie because she travels and lectures. In fact, last night she was in Los Angeles at a expo, and she probably was lecturing to maybe 200 or 300 people there. All right, now she spent her whole elementary and high school and junior high labeled as an ADD kid. Not somebody who jumped around or made a lot of noise, kind of the space cadet kind of kid, you know. You know, the teacher would say things to us like, "What's wrong with her?" You know, what are you going to do? Yeah, well, she was kind of the reason I got into this, and it turned out to be kind of a career. So I'm going to try to bring this up and try to start it right from the beginning.
A child's greatest joy is learning. For me, they say a child's greatest joy is learning. For me, it was my biggest fear. I remember on my first day of school, the teacher told everyone to hang their book bags underneath their names. And I stood there just in total confusion, trying to figure out which one my name was. That was my first memory of realizing that I had a problem and that I was different from the other kids. I was dyslexic, so the words were jumbled and numbers didn't make any sense. I was using a calculator in 5th grade, and my teacher got frustrated that I was using a calculator because I had the math, was at a math level of like a 1st grader, so I needed a calculator to get by. And he threw my calculator across the class and started screaming at me in front of everybody. And it was like, it was just all this negative reinforcement constantly. It was just a nightmare. I had such anxiety about going to school, and I was made fun of. I was bullied. Kids would tell me I was stupid. They would say stuff behind my back. And on top of that, the teachers would too. And when I was a teenager, I remember being in gym class and deciding to push myself to run the mile. I'd always been told not to participate in gym class because I had poor coordination. And one year I just said, you know what, screw that. I'm going to run the mile, and I'm going to prove to myself that I can do this little task. Because if I can do this, then I can do anything. That is what changed everything for me, is finding fitness. My dad taught me how to lift. It was the first time that I actually felt like I was good at something. It gave me all the self-confidence and that reassurance that I had been needing so much in my life. I started to embrace my differences. The things that held me back were the things that pushed me. Attacking your biggest fear doesn't make much sense. But when you do with every ounce of your being, we'll call you names. Champion, warrior, winner. I'll take that.
So I think that the gym stuff was done at Gold's Gym, you know, out in California. And it was produced by a documentary producer, director. And she never asked me about it. Didn't ask for any advice. She just did it. And I think she did it so well that I just use it all the time. It explains what a little child's going to go through when they are confronted with a teacher who is not necessarily terribly sympathetic or kind of says a lot of negative things.
What was the name of the producer director?
Chris Bell. He did.
Because my cousin Christopher Brock is a documentary producer out.
Prescription Thugs is one of his movies. It's all, they're all on Netflix. Now, this is what I want to bring to your attention. This is basically 4 neurotransmitters. And it breaks it down at where they work and how, you know, what are their functions. And you have that in your packet. But the most important thing is that this one marked occipital. I should probably just stand back. The occipital is basically a serotonin neurotransmitter. You don't want to be fooling with serotonin with a child. This is where that problem with suicide and that type of thing comes in with Prozac and Zoloft and Paxil. You don't give those to a child. So that's not a neurotransmitter that fits into our story here. Now on the far end, the frontal lobe energy, that's dopamine. Now dopamine is usually associated with depression, low energy, that type of thing. Dopamine deficiency can be quite profound, but it's probably not ADD. Now it may prevent a child from learning, but if you can raise the dopamine level and get the energy correct, you're probably going to function pretty well. What we want to really concentrate on are the two center ones, where it says, in particular, I don't know why they put the, oh, there it is, primary neurotransmitter, GABA, and then the other one is acetylcholine. So the GABA neurotransmitter, and I guess I can do this, let's see, that's the calming neurotransmitter. It's the focusing neurotransmitter, and it's the inhibitory neurotransmitter. 90% of our brain, at least that's what they say, is committed or works in inhibitory activity. And that way we don't all act, you know, crazy, running all over the place. We have to be able to inhibit our behavior so that we can function, you know, in society. I mean, it doesn't matter what your society is. It could be a caveman, but you got to go in the cave at night, and you can't be running around and jumping around. You got to sleep at night because the next day you got to go out and hunt. So you got to conform, and you inhibit yourself. You pattern into that. So child goes into class, if they can't inhibit, then they're going to be screaming, jumping up, running around. They're just not going to behave very well, and they won't learn very well. So GABA is your calming, and you know, if we look at some of the symptoms here, you'll get it right away. Twitching, hyperventilation, flushing, tachycardia, palpitations. That's, you don't see too much of. Cold, clammy hands. See that a lot. Paresthesia, that's, you'll hear ADD children, they can't stand tags in their clothing. They can't stand certain fabrics in the way they feel. That's what that is. Tingling for no particular reason, itching. Before you know it, you've got a tick kind of thing going on where they're always doing this, pulling at their ear or scratching or something. Chest pain and discomfort sometimes. Restlessness, yes. Blurred vision, tinnitus, I don't get that, but it's in there. It happens. I think it might be more coincidence. Smells, that's actually something that does come up. Lump in the throat. Actually, that's more common than you might think. Butterflies in the stomach. A lot of stomach ailment. Oh, I don't want to go to school. My stomach hurts. You know, the whole thing. So that's GABA. Let's see if we can get.
What does precursor mean? It's second line. GABA is amino acid precursor is glutamine.
Well, that's what creates GABA.
Okay.
Your natural GABA. You can do it. Well, that's the natural part of it. You can add taurine, and that would produce GABA. And there's other things that produce GABA. Okay, so you see what it says there, brain calming supplements. We'll get into that, but I think you'll see L-glutamine is there. And there it is right there. So all these things produce a little GABA. And then there's also the amino acid GABA, which you can take, which we use a lot of. So that's a big item when I'm working with children like that. Now we have the acetylcholine neurotransmitter. So this is your processing neurotransmitter. This is how you sit down and you do something and you finish it, or you accomplish it. So when you see an ADD child and they have a report to write, you know, and they have a real weak spot on their acetylcholine neurotransmitter, they're going to have a hard time even imagining what the finished product looks like. They're going to sit there and they go, how do I get this together? It could be a one-page report. where do I start? How do I get, the end? And maybe they can't even envision the answer, so their result is horrible. It doesn't make any sense. It's just, this is not what we even asked you to do, is what the teacher's going to say. Well, they can't process, they can't do the steps to get a finished product. Now, when you're older, you get a job, and usually the job, there's an outline of what you're supposed to do. So you step by step try to knock it down and get the job done. Some people do it better than others. Right? Maybe they're in the wrong job. That happens. I've been in the wrong job lots of times. So, and when I left, I was very happy. So, yeah, nothing wrong with that. But there are some people who have that art of being able to accomplish, and they're using that acetylcholine neurotransmitter. They're using that to the best of their ability, and they seem, you might look at them and go, wow, that guy's very efficient, or this child is very efficient. Well, they're doing their processing well. So two things you look at an ADD child, you'll see it on the Feingold inventory, processing. In fact, on the Feingold inventory, one side is, there's two columns here. One side tends to be a little of the acetylcholine-ish type of thing, and the other side tends to be a little more of the GABA type of thing. And when I read this, when I read your inventory for the child or adult, I'm looking at what crosses over. Sometimes nothing crosses over. Sometimes one neurotransmitter is fine, but they might have a different problem. So I need to look at that carefully by looking at all the diagnostics on there. Yes?
Can these situations continue into adulthood if not diagnosed?
Oh, yeah. Yeah, but here's the nice part, or the better part. As you get older, generally, you're able to adapt. So what you weren't doing well at 10 years old, at 20 years old, you probably are doing a lot better. It's part of maturity, and you expect that to happen. When it doesn't happen, it gets ugly. All right, now you have an adult who doesn't function very well. All right, and the prisons are full of people with ADD. And they're there because they have inhibitory problems. They do things, why did you do that? I don't know, it sounded like a good, my friend said, let's steal the car, and we jumped in and stole the car. Well, now you're in jail for 2 years. And when you talk to them, it's almost like, I don't know, that doesn't sound right to you, You should say, well, that's something you don't do. And you tell you may not say to your child, don't ever rob cars, but they get the message. You're not supposed to be stealing and doing things like that. Some people don't get the message. They don't get the message because they don't have that inhibitory ability. So you go to a lecture like this is a good example, and everybody sits and listens. And children, not so easy to get that kind of 100%. But if we had people here jumping up and down, you'd be a real mess, wouldn't it? So society hopes that you were able to inhibit yourself enough to sit here and do that. Now, you've been someplace, maybe in your lifetime, where you're somewhere and there's one person who's creating a ruckus, interrupting, or just something's going wrong. Well, that's your person that can't inhibit their behavior. And it's not going to, you may only see that once in a lifetime, you may see it 2 or 3 times, but that's that person that right into adulthood they've had problems. I see them when you're shopping. Retail's a good example of this. There's very often a customer that just cannot be satisfied, and they're yelling about this and that, and you didn't treat me right, and the whole thing. They're inhibitory barriers. They're just letting them down, and they're just, dumping on whoever the person is that's trying to help them. Could be a little bit of that too. Could also be that it's an awful place. So you got to be careful. So,
I have a question about this slide.
Yes.
How does magnesium address an acetylcholine deficiency?
It is a precursor type. It would help.
But it's an organic element as opposed to acetylcholine.
Yeah, but when you talk about the whole body and how the whole body's functioning, the magnesium's going to calm you down. going to take away spasm.
It's not fixing a deficiency in ACA.
No, it's not.
Instead,
To
addressing
fix a
symptoms.
deficiency, this is acetylcholine. GABA isn't doing that either.
Right.
GABA is just making you calm and more inhibited. Phosphatidylcholine, however,
Sure, that's a precursor.
yeah, cod liver oil, DHA, which for some reason isn't on here, got, I guess, bopped off somehow. Amino acids in general.
Okay, I understand.
Yeah, but this is just a general group of supplements. And you don't all right? You see a bunch on the table, I'm going to kind of go through them. You don't use them all. And that's what the Feingold inventory is so nice for. I can actually say, oh yeah, I think GABA and phosphatidylserine might be good for that child or adult. So to me, that's important. Our testing at Abington was $998. I don't know. I don't know how we came up with that. It was there when I got there. And we never wanted to break the 1,000 mark because everybody else had broken the 1,000 mark at this point. And we thought, well, we have a program. We're not just testers and diagnosing it. We do it, we do the testing and we diagnose, but we also treat. And we treat, it was a non-drug program. So we were treating with some very complicated things, and it was a long, many visits and expensive. So we weren't going to charge $1,500 for the testing. I think it's now close to $2,000. We wanted to keep it at $998 or $990. I forget what the actual thing was. We didn't want to break that 1,000 mark because we wanted them to be part of it. We didn't want to scare the parents, you know, with this, you know, a $2,000 test and say, you know, now we have a program for $4,000 that you can enter. It just was a lot of money. Yes?
As far as you know, conventional health insurance as we know it, like HMO, doesn't cover any of the testing.
So when I took over as director, roughly half of our insurances were paying something for our treatments.
Oh, good.
Most of them, or not most of them, some, still half of them paid for the testing too.
Is it getting better?
No, it's probably it's gotten worse, I'm sure. And I haven't been in the insurance thing for a long time. It's probably gotten worse. Unless you buy some super insurance where you're literally paying as much for the service, you know. You know, you're getting into a system where somebody's actually doing something for you as opposed to, you know, putting Ritalin down your throat every morning. And we'll talk about that a little bit too. So I just want you to understand those particular neurotransmitters. Let's see if there's anything else. Nothing on there. Okay. All right. So remember now I said about labeling. You don't jump to a, you know, you can take your child to a psychiatrist or a pediatric neurodevelopmental specialist, and you'll spend your $2,000 or $3,000 or $4,000, and they'll say, oh, they have ADHD. Whoop! You just got the label, and you missed, you know, that opportunity to experiment in other areas before you got labeled. And that could be a roadblock for the future. So you got to be careful about this. I like the word learning differences. Much better way to approach it. You don't want to tell your child they have this and that. Just, you know, call it learning differences, and it'll make everybody happier, and adults too. So here's a definition. We've heard all these things: attention deficit disorder, attention deficit hyperactivity disorder. I still prefer the idea of learning differences. We called our program at Abington the Abington ADD program. As I look back at that, I'd say, that title got kind of old. We probably would have changed it about 10 years ago. I think I left them in 2003 possibly. And even then I had a feeling that the title was necessary because nobody knew what you're doing. Or is it time to change? And I was on that cusp to make that name more appropriate.
I'm not sure like learning differences either, because I think that culturally it's Less intelligence, yes, and
Yeah, well, you-
dyslexia, and you know, very specific. Whereas being in education as well, everybody has a different way of learning. I don't know what category it should be under, but I do have a little bit of a problem with learning differences because I think the kids also go like, oh, you know, they don't like it either.
Well, it's hard for a child to understand any of it.
Yeah.
Yes.
Isn't learning kind of like migratory patterns? The majority of people go towards the more comfortable places.
Well, yeah, and you know,
You can learn what's at the North Pole, but you really got to prepare yourself, and you got to go the opposite of everybody that's going on vacation.
you know, a child with dyslexia can look at a problem that 10 other people looked at and couldn't solve and just solve it. Because they look at things a little differently. To me, that's a great difference. You know, they have a talent. It's just that it doesn't fit into what, you know, whatever that situation was, that learning place wants you to do it this way. And I hear that all the time. I'll show something to a child, and if they have that, maybe a dyslexia, and whoa, they just looked at it totally differently, and I get the idea, boom, that's a great answer. Sometimes it backfires. So they don't, you know, everybody goes, oh, what a dumb idea. You know, the worst thing that could happen. Yes?
I like multiple intelligences theory.
Yeah.
Like there's 8 or 12 different ways of learning, from mechanical-minded, body smart, there's different ways that you're smart. That's what I would always try to find that in kids that may have been diagnosed really early when I was in.
So my daughter says there that the running, everybody told her don't do that, and she did very well. I was there one day, and she was in 10th. I think she was in 10th grade, and she outran everybody on the team. Suddenly, she's not, you know, this child that's not doing so much. Suddenly, she's the thing on that team. Big difference. But I believe I saw a difference in her when she was, I think 5th grade. She decided she wanted to be in a play, and they had to try out. And my wife and I thought, oh my God, she's going to have to learn lines and all that and stuff she couldn't do. And they're, okay, good luck, you know, go ahead. She did it. And I saw a big difference after that. Suddenly her self-esteem was through the roof. That's what I think she really took off. After that, she got a lot of confidence. So most kids are getting that, you can't do that, oh, you did awful. How much can they take? How much negative feedback can they take? And they get a lot of it in school. Yes?
I was a victim of heavy metal toxicity, for which I'm grateful to Dr. Harris Brady figured out and treated me this oral chelation. Could it be possible that she was compromised with her immunity through heavy metals in her mouth through dental fillings?
No, but that doesn't mean other kids couldn't be.
So there is a possibility that it could affect your immune system.
But I just don't think that's, I think that's a small percentage of what we're talking about. Yes, sir.
I only have this example through my son, but it seems to me a person who has difficulty learning in a regular setting develops possibly an ability to excel in a certain area and becomes very focused on that ability. In my son's case, he's taken that to create a business that's very successful. Has won Best of awards through the Intelligencer newspaper and so forth. So,
look at your average artist.
You know,
not going to be in rocket science.
So that I think on the one hand it may be a difficulty, but on the other hand it may be something that produces a very worthwhile human being.
Sure. No, absolutely. Musician.
Hyper-focusing also.
Well, hyper-focusing can be part of the problem.
Yeah.
It happens a lot. And our psychiatrist at our practice, and I'll give you a perfect example, we had a fire drill, so the whole hospital had to be evacuated. And I, got the patients out the door, the elevator, and then go outside, and I'm waiting. Fortunately, it was okay weather. And I go back in, and I walk into his office, and he's sitting there on the computer. And I said, "Did you come in the back door?" He said, "No." He says, "What do you mean?" I said, "We just had a fire drill. The bells, it was so loud, you couldn't stand it." He didn't know it. Never noticed. The alarm was right outside our door. It was impossible not to notice. He just kept working. And I know a couple weeks earlier with him, I went to his house because I had to give him something after we closed. It was a Saturday. He didn't work Saturday. And when I knocked at the door, and he was a bachelor, and he had big dark shades, and he says, he's going like this, "Oh, what are you doing here?" I'm there. "Well, it's Saturday afternoon." He says, "Oh my God, I never went to sleep last night." He worked through he didn't even notice a whole day had gone by. He just worked on the computer. So that's hyper-focusing, and it's not a good thing. He would crash.
Yes.
And he couldn't get to work Monday sometimes. So when he did that, it was a disaster. Did you have a question? Okay. All right, so these are the symptoms. Disorganization. Obviously, lack of focus. Have a hard time paying attention. Yeah, all those things. Having trouble staying on topic. But when you get in, these are very obvious. When you read the Feingold inventory, you're going to see things that seem a little peculiar, such as, how do they sleep? Do they sleep talk? Do they sleep walk? Were they a bedwetter? All kinds of things that you would think, what's that got to do with it, maybe? But it does have to do with it, and Feingold was a genius.
I didn't feel any difference.
So, let me just flip another one here. Kids with hyperactivity, well, we all know them. Fidgety, squirmy, they prefer bouncing, you live in a neighborhood and you're in the cul-de-sac and you hear that ball dribbling every day, 10, 12 hours a day. And why did I move here, But that could be a kid that just has to do that. That walking around thing, I've seen that a lot. Having trouble playing quietly. They don't like doing a puzzle where you got to sit there. They want to be moving. And that's just part of that hyperactive ADD. Always on the go. Well, there's also personalities that are always on the go. Doesn't mean they have hyperactivity or any attention problem. There's just some people that can't sit down. They got to be doing this, they got to be doing that. Doesn't mean they have a problem. So you got to be very careful how you label somebody, and that's why the diagnostic thing is important. You should have good testing. Impulsivity, that's really that GABA neurotransmitter. If you see impulsivity, there's something going on in that GABA neurotransmitter. They don't have that inhibitory quality that would make them look like what you want them to look like, what you expect. This is important. So, I don't know if anybody here remembers the pharmaceutical company Ciba-Geigy. All right. So, I think I was in a pharmaceutical company just about at this time where the government decided to classify amphetamines, weight loss products. There were weight loss, if you were in Northeast Philadelphia, South Philadelphia, there'd be the corner house, the corner row house, and there'd be a doctor who had the basement part maybe, and he would be seeing weight loss people. And up, if he had the 2 levels above, if you went in there, you'd find drums of amphetamines that he would buy, ship to his office, he'd put them in envelopes and give them to people and send them home. and these were amphetamines, and the people that took them, almost 100% women, were addicted to them eventually. And that's what these drugs were for. Now, they brought out Ritalin maybe a little too late. So they're thinking, oh God, now we've got a classified product. Very hard to walk into a doctor's office, and say, we use my drug, and it's good, but it's a class 3 narcotic, or whatever. It has a class 3 designation, and now the government's following me every time I write a prescription for this. I'm being put down somewhere. That kind of killed that business, and those weight loss doctors disappeared for the most part. So, and you can't buy those the way they were doing it and then put it in envelopes and give it out. Now you had to actually write the script and give it to the patient, and now you're on the books. So what are we going to do with Ritalin? Can't use it for, well, we can use it for weight loss, but what are we going to do with it? They discovered that it creates a little more focus and concentration for a lot of people. That's interesting. Maybe we can give it to children who have ADD. And guess what? They made a fortune. They made a fortune. Not only did they make a fortune, they went into every single school and set up a support group. And in the support group, and I used to go to these things, all they talk about is taking Ritalin, so your child behaves in the classroom. It was a wonderful way to promote this. And so, the one parent would bring another parent, oh, your child might need this. And before you know it, it's like a mushroom. It was the greatest marketing thing maybe in pharmaceuticals for that whole decade, or maybe 2 decades. Yes?
When my son again was growing up, the explanation for Ritalin was that it would put him over the top because it was, if he's hyperactive, and Ritalin evidently had, high energy or caffeine properties, whatever it had in it, so that it would make him go over the top and therefore suppress his ability to...
Let me give you a little deeper explanation to that. The reason the Feingold inventory has a lot of sleep issues is because someone with a hyperactivity like that very often have a lot of sleep delta waves coming through while they're awake. Almost tells you don't sleep very well. So what Ritalin does, it's like fire, energy. So it boosts them up so they don't feel like they're going to go to sleep. A kid that's tapping his toe like this is maybe very possibly trying to keep themselves awake. So what we're doing is we're giving them so much energy, they're no longer fighting the sleep issue. So if you put them on if you put their brains, you brain map them, with electrodes, and you put them on there at a sleep center or whatever, you'll see that when you do a 2-minute study, you average out the brain waves. Let's see. Well, I'll bring that up again. There you go. On this piece, you'll see beta, theta, alpha, and delta waves. A child that's a hyperactive child like that may very well have too many delta waves. So when you hit the button and you do an average of what waves are coming through, here's alpha, theta, and you go, whoa, this is way too much daytime delta wave. This child is kind of asleep in a certain way. Maybe too many theta waves. It's all bunched up. Let's just look at it. Just think of your FM radio dial. All right? This far end over here where NPR and the lower numbers, the 90s, the 88s, that's your delta and theta waves. You want to be up above NPR, so you have more of those thinking waves. You don't want to be up at the big end either, because they're gamma waves, which are, you can't focus with that at all. It's like, oh, I'm all over the place. It's got to be that happy center part, alpha waves, beta waves. They're your focus, concentration, calming. So if you've got too many delta waves, you're over here, not doing very well. Ritalin brings you right there. Boom. Yes?
Oh, gamma waves made the Incredible Hulk.
Well, they may have, but did you notice his behavior? Yeah, yeah. Yes. Did you have a question? No. Okay. So it's important that those waves, when you're awake, are in there in alpha and theta. I'm sorry, alpha and beta. But if there are too many in theta and even delta, we've got a problem. And I'll give you a perfect example. We had a child we were treating. We're 10 sessions in. Everything said they had ADD. And I just turned to the, and this is before I used the Feingold inventory, I turned to the mother one day and I said, I don't get this. This is not working. We're not making progress. And we had ways of testing the progress. I said, well, how's he sleep? And she says, hey, he sleeps through the night. And I'm there, does he snore? She goes, oh yeah, he snores all the time. Well, you know, what we know about sleep studies and snoring, you know, that whole thing in adults. And I said, does he thrash around? Does he talk? And she goes, oh yeah, he does all that, but he sleeps through the night. So I happened to just say, can you open your mouth for a minute? And I looked down his throat. He had tonsils. They were pretty big. I don't know if I've ever seen tonsils that big. They were like my thumbs. I mean, they were big. And I immediately said, we got to stop. I want you to go to an ENT guy. The ENT guy looked at him. He calls me back and says, I've never seen tonsils this big on a kid. So we removed the tonsils. It was a terrible thing for him. He did not do well. It took him about 6-7 weeks to get over it. And then after that, he had no problems. He started sleeping quietly, and he got good sleep. And when we did bring him in and test his waves. He was a totally different brainwave person. Totally different. We would have never accepted him in the program with those brainwaves because it didn't show ADD. Yes?
Were there no other symptoms of the tonsils? Tonsillitis?
No, he actually was perfectly healthy, but it was ruining his sleep. So that's an important issue, and that's why Ritalin works. Ritalin would have worked on him. Probably would have harmed him. Now, let's just keep talking about this group of drugs. Adderall, slightly different. When the drug rep comes in, and initially, it's old now, they said, but this is not like Ritalin. Adderall's different. Well, that's nonsense. They're all amphetamines. And the Ritalin and some of those names, Concerta or Metadate, I forget which one. I think it used to work for Metadate. They're just a little extended action. Once they went generic, they could play with a molecule and not have to pay anybody. So they made an extended release product with one of them. And it turns out that for a lot of people, extended release works better, but not for everybody. So the problem with these drugs is that it can inhibit your appetite, so you get a child that could actually lose 20% of growth. But the big thing, and there's a whole bunch of other things that could happen, even including suicide. So I mean, can't play with that. Heart damage. Amphetamines damage the heart muscle. When you give it to a child, you're going to damage heart muscle. And maybe when they're 50, they're going to develop congestive heart failure instead of 80. Now, where does that leave them? You know, he can focus, but he can't get up and walk because he's got congestive heart failure. Yes?
My understanding is it's a down regulator, which means it triggers your natural boundary system. So it looks like an upper, but it's actually a downer.
Well, it sounds good, but I wouldn't.
So it goes up, and it'll trigger your safety.
Yeah, I'm not buying that. Yeah.
Sort of like what I was...
Right, exactly. Somebody told me.
Yeah. I'm not sure. Well, first of all, every drug, including Ritalin, when it says, when you read the package circular and it says, you know, how it works, one of the first things in that package circular is how it works. And I've never seen a drug that doesn't say hypothetically it works this way, because they can't prove it. So I'm not ready to buy that at all. Never was. I never even thought of it that way.
But if it does knock it down, you might, if your energy was low, you wouldn't need to eat as much, so you might lose weight as well.
Who knows? But it does suppress appetite, and we know that because it was the king of the diet industry.
Yeah.
Yes.
Although this may seem extraneous because I'm talking about two products that my mother used when I was little, does anyone know if Rem for coughs and Fletcher's Castoria for irregularity were all natural, or did they have drugs?
They're pretty old drugs. Fletcher's Castoria, I think, was castor oil.
Was that all it was?
For constipation.
Yeah.
What about REM for coughs?
Oh, REM. You know, I remember that now because they had ads on TV. I have no idea what that was.
You don't know what the constituents?
No. Is it banned probably at this point?
Is it used anymore or not?
I have never seen it.
Dr. Phil, can you go back to the class of drug slide for a second?
Oops. Let me try it manually. You mean this one?
Yeah, I say yeah. Thank you.
You good?
Need that slide?
Why? There you go. Side effects. Sleep problems, sleeplessness. You get a kid that won't go to sleep, you got problems. And I like to call that kind of wakefulness too, you know, like they can't really put it down at all. Delayed growth, headaches, stomach aches, rebound irritability. Oh God, you don't want that as a parent. Tics. It could be subtle tics, but they can come out when you give them Ritalin or one of these amphetamine-based products. And if you think the teacher's not happy about the behavior being a little hyper, wait till the tics start coming out. They're not going to like that at all. Moodiness, irritability, of course, suicide. It's always an issue. Seizures. You know, who wants to see a seizure in a child? Oh, here you go. Increased heart rate. Well, that's part of the problem. By increasing the heart rate, you cause heart damage. Heightened blood pressure, heart damage. Temperatures. Sometimes kids can get temperatures from the drug. Muscle shakes and tremors. Might be close to the tic thing, I'm not sure. Agitation. Don't want to see that. That is not good. They could develop depression and mood disorders. Parent sees that, that's a good reason to stop the drug immediately. What are some of the long-term side effects? Extreme weight loss, reduced sexual functioning, all kinds of gastrointestinal problems, muscle issues, cardiovascular damage. Breathing damage I've never seen, but I've heard it in the literature. Headaches, cerebral hemorrhage, that's a stroke. So that's kind of scary. And seizures. Yes?
Why is agitation dangerous in your kid?
Well, you already got a hyper child, now you got an agitated child. And either it might agitate them so much that they might kill themselves, that'd be the worst scenario, or they may hurt somebody else.
I have a kid, and it says that when they're angry they need something. So why would them needing something be dangerous?
No, I'm not following.
It's called protective. It's when you have kids and you actually study their temperament and stuff, where it comes from. It comes from need. So it might sound nice that it would be dangerous. Nobody is comfortable with agitation, but my kid's not to be mad.
Yeah, but when you give them the drug, that's where the danger comes in.
That just means they need something. My neighbor told me it's my job to figure out what they need.
Well, I don't know your neighbor, but I got my own idea on this.
Isn't that good parenting?
Maybe.
Maybe.
So what are other treatments? Diet, high fat. Now, we'll talk about that in a second. The Feingold diet, I just wanted to mention. Feingold diet is a very specific diet. It's kind of fallen out of favor, but it had to do with certain foods that had ciliates in them, which are kind of like an aspirin kind of thing. And cherries have, and a lot of things that are pretty good have them, and nobody's really stuck with this concept. So it's fading, it comes up once in a while. There was a point where communities had these Feingold nurses that would help people do this. And it was kind of to go against, not specifically, but kind of was something to go against the Ritalin groups that were out there. Well, now we have Feingold groups which don't use drugs. That he didn't like drugs for that. But Feingold has kind of disappeared. Now, 25 years ago, I'm watching, I think it was 2020, and they showed kids with epilepsy, and they gave them 80% high-fat diets, and the epilepsy went away. No more seizures. As long as they stayed on. And by 6 or 7, sometimes those kids were permanently cured from their epilepsy. So that's what that means. 70% fat, 20% protein, 10% carbs. You can really up a child's performance, calm them down very often with that diet. Sounds, you know, your doctor's going to go, oh my God, you know, because they just don't know any better. But that can help, and it can help a lot. So what do we actually give a child today? You know, they eat things out of a bag. They eat, what's that macaroni thing? Baked macaroni, you know, with cheese. That's what they want. What else? Oh, energy drinks. That's got to be the worst. But they eat really a lot of junk, and it certainly doesn't fit that pattern. They don't eat meats very much. They don't eat those things.
Sugar blues.
Yeah, and then you get them into a sugar addiction. How's that going to make them look? Yes?
A question about Feingold diet. I once worked with a woman whose daughter was on that, and she said that the secret of it was removing salicylates from the diet.
Yes.
What are salicylates?
They're aspirin type derivative. Now
aspirin.
Yeah. Now researchers really looked at that back in the 40s. Salicylates. If you look at that yellow 5, it is related somehow to that. And I worked for Bristol Myers, and we used to make antibiotics, and we were very proud of ourselves because everybody's antibiotic was pink, but ours was yellow. So the doctor loved that, and the pharmacist liked it, and the parents are, what is he taking? You know, if you're on the phone with him, it's yellow, and you know, we give them to him on a spoon, and they go, oh, there's only one thing that can be, that's Bristol Myers antibiotic, you know, and you know, I think I sold a ton of it over the years. You know, I was part of a group, even when it went generic, I became part of a group that sold it to thrift drugs and all the big chains, and we made a killing. And then one day the government said, you can't use that anymore. And we all went into a panic. Well, what are we going to do now? We've got warehouses of yellow antibiotic, and that all had to go in the trash and be destroyed, and we had to go into the reds because that was all the FDA was accepting. Actually, the reds may be worse than the yellows. We're not even sure, and they're not sure. But Feingold has kind of faded away. But that Feingold inventory I use, you know, that man did it, and that is such a simple tool. I mean, we would rule out 50% of the people that came to us just on that tool, and it was that good. So you do have to worry about allergies. Allergies can affect behavior. And I always look at allergies. What allergies does this child have? Sleep disorders. Well, that's, you know, it's on the Feingold inventory. I'm concerned about that. Biofeedback and neurofeedback. At the hospital, I did a lot of neurofeedback. And we were part of the University of Tennessee's program where, you know, they would, at the end of the day, I'd push a button and send all our studies to the University of Tennessee, because we were part of that group, and we had to do it exactly the way they told us, our treatments of children using neurofeedback who have ADD. So it was important we diagnose the child correct. You don't want to be putting information into the system for a child that doesn't have ADD. It really throws the numbers off. So that's why we rejected half of our people that came to us. We were sure they didn't have ADD. Was there a little bit of, you know, still a mistake or two? Probably. I gave you one with the tonsil kid. He got through. So now I only do biofeedback. I found, you know, with a new software, I found that you can make this system much simpler. It doesn't have to be so costly. And you can train the child very easily. They can go home and work on it with a parent, or an adult can work on it. I even have a program, it's called, might as well show you this, assuming I can open the phone. I use this for a number of conditions. It's called, it's free by the way. It's only on iPhone, it's not on the other style yet. It might be eventually. Breathe to relax. So I might use this for anxiety. It could be a great training tool for ADD, and it's very simple. You just, once you set it up, you hit the button. There's a lady in there that starts talking to you, and she tells you how to breathe. And this relaxes a child, and it can be very helpful.
As you end this exercise,
it's free. You know, it changes everything. I can teach somebody how to train with a clock with a second hand. Free. You know, all you got to do is pay me to teach you how to do it. And the big thing, supplement therapy. So in '92, when I started looking at all this stuff, we didn't have a lot of these supplements. I don't know if we had much at all. Maybe some of the fish oil things. But we have so many good ones now. We did have GABA. We didn't have a good form of GABA. Now we have pharma-GABA, which crosses the blood-brain barrier very effectively. So things really, after 2001 or 2, things started to improve. So we have a lot of great products, and I'm going to go over them, that might be helpful. GABA deficiency. There's a GABA, pharma-GABA, I just talked about it. Great way to treat it. Comes in chewables. In fact, I'll hold that up just to show you. Well, maybe we don't have the chewable. Yes, we do. Chewable GABA. Not a bad thing for a child. Yes.
Since you're going to be going into this soon, and you've also talked about the biofeedback, which we have a 21-year-old going on 13, but and is independent, living on his own on the other side of the country. We've got a compliance issue with him, even though he recognizes he's very intelligent, he knows what the issues are, he knows what he needs to do in terms of taking supplements, but forgets. But by non-compliance, it's not resistance to do it, it's just part of, you know, the cycle. He's forgetful, forgets to take it, goes into the and then the consistency of the treatments, including, I mean, we've got so many apps.
Yeah.
Try this app, try this app. Just does it. So how do we deal? How?
I don't know yet. That's very specific. It might be a motivational thing. It could be a lot of things. Just want you to know that when I was with Bristol Myers, I did a study on antibiotics where we monitored compliance with 3 doses a day. And only about 50% of the people can do 3 things a day.
Yes.
All right. Now, of course, you got to understand, we're doing this because we're going to bring out something you take twice a day.
Right.
All right. We had motives to do this. And of course, once that study was done and they were replicated, we did several of them, then we had the reps go into the office and say, look, they can do 2 a day, but they can't do 3 a day. And the doctors are, great idea.
Right.
And actually it was very successful.
So, because, you know, a lot of your emphasis is on your child and how you, you know, if your child's living at home, you do have a lot more control over monitoring what they're doing and this sort of thing. And as adults, like fully formed adults, you know, you will probably be more doing that. But you got that in-between stage where just too overwhelmed.
So you got to look at it this way. You have your set of things that you want him to do.
Which we know is all good for him.
Of course. But is he really capable of that?
No, he's not.
So you know, when I would look at my daughter when she was little, I used to think, well, this is what they want her to do. But I know she can do this and this, but she's not going to be able to do all of that.
Okay.
And that way, you didn't overwhelm her. You didn't destroy her self-esteem. Oh, she did 2 things right. Very good.
Okay.
So it's just, it's not going to be that easy.
Is it possible for whatever he needs to do to write down each time that he does it so that he can see that, oh, I didn't forget to do it, so I don't need to do it?
Good luck with that. Never tried that.
You won't write down?
No. The only motivation seems to be a financial motivation. But even that, if he has to write it down, it's like, oh, can't be bothered.
On a computer either?
We've been there, done that.
I also found that with my son, there's an oppositional component.
Well, that's a diagnosis.
That's a whole different thing, but it's there.
Yeah.
It's part of the profile.
Mm-hmm.
And
Yes.
He's 37 and he's still up.
Isn't our term something like
Comorbidity.
So there's
Yeah.
12 other things. If you get the diagnosis of ADHD, congratulations. You probably have one of these other 12.
Oh yeah. Nobody has one thing.
Oh, yeah. Well, executive functioning skills, or, all that.
But oppositional defiant disorder can be a real difficult situation. That could be a psychiatric issue that it could end up very poorly. Yes.
Okay.
Yeah.
Oh, I have a son with 19 with similar issues, and I sent him text to say, it has to be motivational because he lives at home. I said, if you do not do your chores at home, you cannot go out with your girlfriend. So that's very motivational. And we will club his car. We didn't do it yet, but somebody gave me the idea of putting one of those clubs on the car. You're like, you can't go.
Yeah, again, he's living at home.
No, the same thing, but we're in charge at home. So that's what,
So you
But I'm not, he's an item.
worst scenario, you can't control them.
Right.
So,
Anyway, all right.
symptoms of the brain has a rhythm. And a lot of children with ADD lack rhythm. And we've tested to see that. And it is obvious once you see how it's done with it's a unit you use. And you'll see the average person, their rhythm is within 98, 99%. And an ADD child's rhythm could be as low as 87, 86%. And all they're doing is just clapping their hands to music, but we're measuring all these parameters, and we're discovering they don't have the rhythm we think they do by just looking at them. So training their rhythm is important, and I did, early on we would use a metronome, and every day for a minute they would just clap with a metronome. You didn't say anything, you just clap with a metronome. And as they did it, they got better at it. And a very simple thing. They bought a $9 metronome at the music store and did it. Today you can bring it up on your iPhone. That rhythm is important though. And that's why sports, especially running sports, sports where you're doing this kind of activity, where you're crossing the field kind of thing, that creates a little more rhythm. And running itself is a rhythm. If you're going to be successful at running, there's a rhythm to it. And running with music on has always been something people like to do because it adds to the rhythm. So the brain rhythm's important. These other things you've seen before on these, but this is just some of the symptoms of people with poor brain rhythm. Conditions related to loss of brain rhythm. Why not anxiety? Why wouldn't that be the #1 thing? If you're not really rhythmic, and you're not doing things right, things start to pile up and you're not functioning real well, that can produce anxiety. And some people can handle it and some people can't. And those that can end up in a psychiatrist's office. Hypertension, maybe. Cystitis, I've heard that. Obviously gastrointestinal things, lack of focus. Bipolar disorder can end up there. Brain calming supplements. Did we see this already once?
Yeah.
Okay. Oh, this is on the chart too. This is acetylcholine, the brain's processing abilities. Choline would be the #1 thing you might consider. DHA, that type of thing. Conditions related to brain loss can be pretty ugly. Natural treatments. Acetylcholine or choline can be the treatment for all kinds of cognitive issues. So for MS, for instance, choline is a key component in MS because it protects the myelin sheath, and the chemicals that make up choline, acetylcholine, helps where the information jumps across all our neural gaps. That you need that chemical in there to transfer that information. Choline adds to that, so it's a good choice.
What's choline in natural foods? What?
Oh, lots of foods have choline.
Eggs.
But eggs, meats, that type of thing.
Okay.
Yeah, it's common, but doesn't mean that the person's getting enough or or they need more.
Can you tell by blood work all this stuff?
Yeah, that's a good one. So we, in fact, one of our nurses is here right now. We have a nutrient test we do through SpectraCore.
SpectraCell.
SpectraCell. Core cell. It's some kind of ADD thing in my mind. SpectraCell has this wonderful nutrient test that we do. What would be the full price of that if they had to pay out of pocket?
$88 for Medicare recipients and $190 for people that are non-Medicare but have other insurance.
And we can do children.
And we can do children, and also there's a $30 draw fee, which is new to that.
Okay. So we can actually identify nutrients that you're low on, and we've gotten some surprises.
We have.
Like serene. Who would think serene's an issue?
Yes.
I have a question. I came for the nutrient testing, and my insurance said that they would cover it, but I needed to get a sign-off from my doctor.
No, there is no insurance coverage. In other words, that is the cost that you pay, $190.
But if you have Medicare, it's $88. Right, but they said they would cover it and make it the $88 price, but you said the doctor had to sign off on it, and they said that it was medically unnecessary, the doctors that I asked to sign off on it. So what do I do if I want to?
Are you Medicare?
Yeah, you already put it through.
Okay. I have a doctor who has agreed to let me do the test.
Okay, so I can come back, because I have the kit and everything at home.
Yes, if you have the kit, and we're doing it on the 3rd Tuesday of February.
Okay.
So I want to talk to you before you leave today.
Okay.
That's all right.
Okay, thank you.
Okay, so I want to move on to this, and then we'll take questions.
Yes, we have a phlebotomist that comes in.
If you've ever seen L-theanine, and this is Pharma-GABA, they both work on the GABA neurotransmitter. So if a child is on other drugs, GABA might be a problem. But L-theanine seems not to have drug interaction issues, so I'll substitute L-theanine. Or in some children, especially that have a lot of the body movement and all, L-theanine might be a better product. You kind of have to pick and choose on that. But normally, for focus, inhibitory quality, Pharma-GABA is probably your best. So L-theanine, Pharma-GABA, this comes in a...
Didn't you say anxiety, Dr. Phil?
Well, L-theanine is excellent for anxiety.
Yes,
GABA could be too. There's a chewable L-theanine. Same company. These are, I think this is the only This is the only company making a. No, there are a couple other companies. Somebody's making a chewable L-theanine. Possibly, and then Country Life.
Chewable gummy.
Oh, gummy. They have gummies.
L-theanine?
Yep. L-theanine adult version, 200 milligrams. Sun-theanine, by the way, that's crosses the blood-brain barrier better. That's what most of our products are, sun-theanine now. They're not just L-theanine. This is actually a sun-theanine, if I'm not mistaken. Well, sun-theanine is just a better quality, crosses the blood-brain barrier easier. You use a little less. That's an L-theanine also, and that's a sun-theanine. This is, before I get to that, I want to do, you saw these, this particular situation. This is by Jarrow. This is Neural Optimizer. They have choline in here. They have phosphatidylserine. They have taurine. They have glutamine, B6. So they're stimulating a lot of neurotransmitters with a bunch of different products.
What is that called?
This is called Neural Optimizer. It's kind of an all-in-one product. And if it works for you, it's great. Now, it's a little more money because Serene and all these get pretty expensive, and they got a lot in there. But if you had to buy them separately, you'd pay 3 times that price. Good product. That's just good old phosphatidylcholine. You know, that bottle's $12 or $13. Well, this might be the big bottle. This might be a little more. Yeah, this is Country Life that makes this. And we have one by Solgar also out there. So this is just good old choline. I use it for all kinds of things. But for adult focusing in particular, it's pretty good. Now, you might have to take 2 for breakfast and 2 for dinner. But you start with 1 for breakfast, 1 for dinner. And see how you do. And you can always up it. You don't want to go too high on choline, but you could take as many as 6 a day, and I don't think you'd have a problem. This is a little different. This is where the magnesium comes in. If you're having problems sleeping, if you're having trouble concentrating, this crosses the blood-brain barrier. Much better, just much better choice than other magnesiums for this condition.
Source Naturals, which one is that on this list?
Source Naturals, Magtine, it's an L-threonate form. Yes.
Is turmeric beneficial for any of these things, Dr. Phil?
Magtine, L-threonate. Yeah. There's other brands. It's a license, so they have to pay into it. Turmeric has been used in studies because very often a child might have an inflammatory process going on, and it wouldn't hurt. I don't think it's going to give you amazing results. It might just make the child feel a lot better. Now this is phosphatidyl serine. This is a patent item. And it stimulates your own serine that you might need. Now if you look at, let's see, if you look at the circle here, I think serine is right at the bottom. Now serine is involved in all kinds of cognitive things, including late in life cognitive failure. But what we've discovered with that nutrient test is we've had people come in here who have memory problems, that type of thing, and surprise, they also have low L-serine in their system. Now they might be eating meats and they may be doing all the right things, but they're not getting enough serine. So serine in the form of phosphatidyl serine makes it easy. If you had to do it with serine, it's very expensive and you need a lot of capsules. This 1 or 2 a day might do the job.
That's like, we can find that in salmon and stuff, right?
Pardon me?
Salmon?
It's in meats, yeah. All amino acids are going to be in meats. This is Cogna-Aid. This tends to be more for people, more for adults. I probably wouldn't use this in a child.
Who makes that?
This one is by Designs for Health. It's a professional company. We do sell it here. This is also by Designs for Health and Quicksilver, which we don't stock, but it's the same product, same price. So this is a combination of L-theanine and GABA, but it's in a spray. So you just spray it in your mouth, and it goes to work really quick.
Is that the liposomal?
It's a liposomal form, so it's a pretty well-absorbed product. Not only do you not swallow it, you know, it goes right into the bloodstream, but it goes in with that liposomal form. It's very effective.
Can I tell you about that here?
Oh yeah, absolutely.
What's the name of that again?
That's called liposomal neurocom.
So you don't swallow that?
Well, you eventually do, but the point is you spray it in your mouth and you absorb it. These are 2 new ones. Probably don't have as much experience with, but the company is well known. So this is if you have a child that maybe has a lot of mood issues, mood swings. This could be very helpful.
Could you say them out loud because we can't read?
Yeah, what is the
Sure. This is Guna Mood.
Seventh down on your list. The 2
Yeah.
Gunas.
And the other one is Guna Awareness. That may be more ADD-ish. Again, you can experiment with these to see what kind of a result you get. That's a real simple form of melatonin for kids that just can't sleep.
What's the name of it?
This is Life Extension Fast-Acting Liquid Melatonin. Tastes really good. Most kids are not going to give you a hard time.
What did you say?
It's called
Fast-acting.
Fast-Acting Liquid Melatonin, and it's a citrus vanilla flavor. I've used it. It tastes pretty good, yes.
Is melatonin, I've heard differing things. Some of what I've read says melatonin is good for the issue of falling asleep, not necessarily sustaining sleep.
Well, it kind of depends on the person. But that could be true. People, you could have trouble going to sleep, and once you're asleep, you stay asleep, and there's other people who have problems, they're usually anxiety-driven. They go to sleep fine, they wake up at 3 in the morning because now their brain starts to roll. And that, you take it at 3 in the morning, you go back to sleep. Yes?
My daughter is 10 and hyperactivity. So she took steroids because she had a bronchial thing going on. I know this is probably bad, but, so I called the teacher and I said, she's going to be really hyper probably because of this. She called back and she told me that day, she goes, she was an absolute dreamer. I don't understand that. That an anti-inflammatory, because you had said maybe she has some type of inflammatory thing.
Steroids are very unpredictable. It's hard to say what it's doing. Yeah. Let me just say this. This is a wonderful DHA by Wiley's, and DHA might solve your problem right out the gate from a lot of ADD children.
What does DHA stand for?
Well, that's dicosahexaenoic acid.
The last one.
Oh, thank you.
And who makes that?
And that's Wiley's.
How's that taste, by the way? Great.
Tastes good.
Really good.
This is Nordic's version, similar product, Omega Focus. Now I believe they have Bacopa in there, which can be calming and relaxing. So it's probably a very good combination.
It has what in there as well?
Bacopa, that's an herb that's kind of calming and focusing. These are combination products, they're newer products. I don't use them on kids, but they're certainly appropriate for adults. And in fact, it says young adults. This one says for adults 40 plus. So that's
Garden of Life.
This is Garden of Life.
They have a kid one.
They have a kid one. Memory and Focus. Memory and Focus, but this is the adults over 40. This is younger adults. They should have one for over 70.
My brother, my brother and I have a friend who has severe spinal stenosis. I heard on a talk show program that fish oil therapy may help. Have you heard that theory?
You know, spinal stenosis is so specific. It's a narrowing of the channel around the spinal cord that can be pretty bad.
Is there any treatment known to help?
Not many good ones.
Surgery? Do you know of any besides surgery?
And surgery can be kind of iffy too. Yeah.
What they talked about when in some of the trainings that I've been through, that joint food has to be taken in at a greater rate than the breakdown rate, and when in the disc space around the spinal column, high levels of chondroitin sulfates and the glucosamines and the hyaluronic acids and the collagens and all that stuff has to be taken in at a higher rate than this breakdown rate, which is hard to
Does it offer help? Does it offer relief?
It has been shown, yeah. There's some studies we've done with high levels of chondroitin sulfates even by themselves. But those
and my brother, or my dad and my friend of mine have what's that called, insomnia. I've heard that cortisol a lack of cortisol is responsible for that.
Oh, it could be.
It can be,
sure.
Or it is.
Yeah. When you're under stress for long periods of time, you can have all kinds of changes hormonally, and it certainly can disrupt sleep.
So could a doctor help him, a friend of mine?
If they did a hormonal test, see what's weak, what's not, it's possible. Sure. All right, any other questions? You know what? I'm going to give you the mic.
You said there is a blood test available to tell certain nutrition deficiency, right?
Yes.
Yeah, and if the test shows certain nutrition is not deficient, like enough nutrient in the blood, does that mean it's working, it's being used to function in the brain properly?
You mean you're using it up quickly?
Yeah.
No.
Or still, that it can be sufficient, but still there may be a functioning problem. It's not being used properly.
So we do the test and we see that phosphatidylserine is way down. Doesn't mean you necessarily used it up. You may have some issue with keeping phosphatidylserine in your system. You may not be eating the right foods, and it doesn't really matter. If I see that it's low, we're just going to put some in there and then see if the person responds.
Okay.
So it's just the test is just strictly information. How we deal with it is going to give us a result or not.
Okay.
Yeah.
Okay.
All right. All right.
sort of in keeping with the thyroid or the hormone concept. Someone
Can't
who
hear?
has.
Is it on?
I don't think it's on.
On too. It's on.
Someone who has Hashimoto's disease.
Yeah.
And as a result has situations with hormones because of the loss of function of the thyroid. Could be adjunct to the ADD thing.
It could be, but you're starting to get away from the main information here, and is that what about focus and concentration? And the ability to process. Yeah, thyroid could affect
So
it,
then
but it's not the main.
the adrenal issue would come the anxiety and the...
Yeah, you could have a child or an adult who has ADD and they're having all kinds of problems. In the meantime, they're depleting their hormones in some way. They're creating dysfunction, and that's going to be even more trouble for that child or adult. Yes?
There is one theoretical link between thyroid and ADD, and that would be tyrosine. Tyrosine is part of the thyroid hormone, and tyrosine also is upstream from dopamine and those catecholamines.
And I think tyrosine was probably up on the chart.
It's on your list, yeah.
Yep. So yeah, tyrosine's important. And anybody else have any questions?
Difference between diagnosis from a blood thing for the nutritional versus root hair thing?
So hair only does heavy metals. The nutritional test doesn't actually do heavy metals. It tells you what you're short on. And it's going to go through categories like amino acids, minerals. What am I missing?
And they not just tell you what nutritional supplement you can take, but what foods replenish.
Yeah, I mean, it's a different test. Yeah, different test.
How many different? I was going to ask how many different do they test?
I can show you. I'll give you the brochure.
It's a lot of things.
It's a lot.
And it does it in such a way that it covers it in a really healthy way. It covers everything. You can't do every single. It doesn't do broccoli.
Right.
We don't have to do broccoli.
Right.
Because we know the constituents. Yes.
Pretty conclusive.
If you were on this supplement program, at what intervals would you need to redo that to establish whether you're assimilating the nutrients?
I think just by the response.
It allows you every quarter on the micronutrient, I believe, under the insurance guidelines, every quarter, every 4 months.
That isn't always the necessary thing, but you might. It depends on what your situation is.
Taken, not assimilating is my point.
Yeah, exactly. But let's just say you're an adult and you're forgetful. You might want to test after 3-4 months just to see if you've changed. On the other hand, a child with ADD, you might just keep giving them GABA, for instance, and if you see an improvement in behavior, just go with it.
Well, did I understand you to say that with ADD, children can actually outgrow that?
Well, as a child matures, sometimes that happens.
And could there be a hormonal link there?
Maybe, but probably not.
We also do Zyto testing, which has to do with your nutritional needs in standard process. And that tells us, it also tells us your what organs and glands are involved. It also tells us what your spinal analysis is. And it gives us another view of nutrition, and the company Standard Process is the whole food nutrition company, the oldest in the United States. So there's 2 ways to test. One, the blood, the other, the biorhythms, and they're both very valuable tests. I've done them every time they come in. And I do the micronutrient and I also do Zyto. And I'm really amazed each time that the testing comes. And I know, Ann, you've had the testing both ways too. And it's just amazing. I think it's interesting to have a measurement tool. And we have those 2 measurement tools. Zyto and micronutrients.
Yeah. Zyto is bio?
It's the biomeridians, yes. And if you put your hand, I have brochures up front, I'll be glad to give you.
So I'm glad you're bringing that up. We have a lot of services here. And we have a lot of specialty practitioners. And we have our nurses that do that blood work, because a nurse has to do that blood work. You have to have an RN for that.
You'll never find this in the conventional medical office.
And I will tell you this, that you're right, you will not. And you know, the doctor said, you don't need that. But you do, because you do need to know whether you're taking supplements indiscriminately. And this gives you at least a measurement tool. It tells you where you are on the scale. It gives you, you know, exactly what your numbers are. And it's very important to know those things. And you can take that report to your doctor. And it also allows me as the nurse to talk with one of the doctors from SpectraCell. Besides what the report says, we have the chance, and I know Ann sat in on hers when she had hers done, and their nutritionists are just unbelievable. I mean, we feel that that's giving us good reports, but they tell us additional things. And one of the things that I learned, that this woman had heavy metals just because she had a high specific thing in her leptin level. And leptin, I'm sorry, I said leptin. And it's amazing what you can learn from the blood testing, what their physicians tell us about. And I learned that myself. I learn every time I talk to one of the physicians. So please understand, it's a wonderful measurement tool, both.
So the thing is, we're trying to get out to you is we have a lot of different services here and different practitioners that do those services. So it's a good thing to come in, and we have a piece for you to fill out there, and you can actually investigate some of the things we do. Yes, there it is right there. Roberta's holding it up. Thank you. Fill that out, because we can, you know, maybe give you information. It'll also tell you when the next lecture is going to be. And I should mention that I'll probably do an anxiety lecture. There may be other lectures here, but I'm going to do one on anxiety in March sometime. And
are you giving out free anxiety?
There's pardon me?
Giving out free anxiety?
Yeah, I can do that if you'd like. So this is kind of a sheet. It's not a sign-up sheet. It's a sheet just to say, give me a date if you're going to do that. And we'll have a date eventually, and I'll just pass that around.
You'll put it up on the website like you did?
Yeah, it'll be on the website. It'll be at the counter. We'll do all of that. I just want to back up a second and mention that I do the ADD treatments here in the store, and I do them on the computer, and I can do a little additional testing. And you want to do that if you've got a problem. It's either adult or child. We'll do it all. Our other service people have all kinds of services there that you can do. Right now we have a reflexologist in the back room. So, you know, we have all these things, and we're gonna, you know, we want you to take advantage of them. We're not doing it just to fill the room up. We want you to look at our services and give them a try if you need it. So, with that said, do we have any other questions? Oh, we're questioned out. Okay.
Thank you, Dr.